Hi, I'm Dr. David Hill, and today we're going to be talking about fever and lethargy in children. Now, these are two words that have pretty precise definitions when you call up your doctor's office. When somebody uses the word fever with us or lethargy, they mean something very special. So we should probably talk, first of all, about what the definition of these words are to at least your child's doctor. Fever specifically is a core body temperature that is greater than 38.0 degrees Celsius. In Fahrenheit, that's 100.4 degrees. How do you get a core body temperature? Well, the ultimate core body temperature is taken in the rectum, and especially for children who cannot hold a thermometer under their mouth, the rectum is the best place to get a really reliable temperature reading. Don't be worried, you're not going to hurt them down there with a little rectal digital thermometer. It's fine. In my entire career, I have never seen an injury caused by a rectal temperature, and I don't know anybody really who has. I'm sure it's happened, but it's got to be incredibly rare. You can also, of course, if you're really squeamish about that, you can put a thermometer under the armpit in a young child. We say add a degree to that, but if you call your doctor, just tell them what you got and how you got it, and they'll do the addition in their heads. Don't worry about it. So if you get an armpit temperature that's greater than about 99.5 degrees, at least let the doctor know about that. Now, a mouth temperature, an oral temperature, is relatively reliable, at least in a cooperative child who didn't just have like an ice cream cone. And if that's over 100 degrees, we're going to call that a temperature or a fever. Now, there are some newer, more sophisticated devices for measuring fever, and they vary in how accurate they are. The ear thermometer is a very popular device because it seems non-invasive. In young infants and very small children, it tends to be quite unreliable. The ear canal, it's hard to get the aim right, it's hard to get it in there right, and so when we hear about tympanic or ear temperatures, we always take it with a little bit of a grain of salt. A more accurate but more expensive device is a temporal artery thermometer. This is a little device that reads an infrared signal or temperature over the temporal artery right here at the side of the head, and you can buy these. These are also non-invasive, they're more reliable, they're just a really expensive way to go. So if you're worried about your child's fever, let us know about it. Now, there are a few breakpoints in when we get worried about fever. An infant under age 3 months, we are always worried when we hear a fever. That is never okay. It's never normal. It's likely to buy your child admission to the hospital for a further, more in-depth evaluation and IV antibiotics. So don't blow that off. Seek care immediately. Under a year of age, we like to know why a fever is present when it's there. If you call me with a 6-month-old and say, hey, my baby's got a temperature of 101, but he's coughing and sneezing and sputtering, I'm not going to be too terribly alarmed about that. But if you say my child has a temperature of 101 and I have no idea why, nothing seems to be wrong with him, we're still going to want to get a look at that child because of the possibility of urinary tract infection or some other kind of infection that is difficult to diagnose and treat without a really thorough evaluation. Now, in older children, again, an unexplained fever bothers us, but more importantly, any fever beyond 3 days in duration bothers us. So a fever is allowed to go for 3 days, but by day 4, I want to know what's going on. I also want to know what's going on if the fever is over 104 degrees. Now, something important here. A child is not going to cook his or her brain with a fever. They physiologically cannot do it. Now, they can get damage from being too hot if they're locked in a car, if your high schooler's running up and down the football field on a hot day without enough water to drink and without enough rest. Those things can cause damage from high temperature. But your child gets a cold or the flu and gets a fever of 105. I know it's tempting to panic. Don't panic. The fever's not going to hurt the child. However, over 104, I want to know within 24 hours what's going on. And over 5, I want to know over 105 degrees, I want to know now what's going on. So if your child has a fever of 105 or greater, do seek care urgently to find out what the cause of that fever is. Now, let's talk a little bit about lethargy. When I hear lethargy, I am really alarmed. Lethargy to me means a child who just won't wake up the way they're supposed to, a child who has a diminished response to normal stimulation. Now, any child with a cold or flu is probably going to laze around the house, not going to want to get off the couch, they're going to feel lousy. I get that. We all get that. However, if you tell me your child's lethargic, I think you're sitting there poking them or shaking them or trying to stimulate them and you're just not getting the response you would expect, that's always alarming. That always wants an evaluation. Lethargy can come from anything from a drug intoxication to a serious infection to some sort of trauma, and until one of us sees that child, we don't know what the reason is, so we're going to want to see that child urgently. Talking about fever and lethargy in children, I'm Dr. David Hill.